I mean, there's talk here of monitoring of antipsychotic medication, not monitoring it.
Yes.
Like, what sort of impact would that have on children whenever...
Well, take a medical condition. You know, if you're on blood pressure tablets and they're not being monitored, you may be on too much, too little, or there may be side effects with it. So it's absolutely not acceptable that if you're on medication that you wouldn't have the basic minimum standard of monitoring that. It's understandable, not justifiable. It's understandable how it happens. If you have so many children in your service and you have so many turnover of staff and nobody's keeping a record of who's on medication to begin with. So that's where...
Nobody's keeping a record of who's on medication?
Not you, unless you have a paper and pen and a filing system.
Mm-hmm. What do you mean? Well, how is it
not on computer?
Yeah, so you might have 200 open cases on your particular file and you may have no idea from those who's on medication or the diagnosis that they've had. So if
this is prehistoric stuff.
It is. I mean, your hairdresser does better at calling you back in when you need
Why is there no computer system for this?
There just hasn't been that development within the HSE in general. The Lucina services have developed that themselves. It's an independent organisation and they have electronic health records and it makes it far easier to manage.
We've heard before the frustration was, say, in the guards because they had to have triple everything on paper and they had nothing on a computer, so they didn't know what was going on. And now, within the HSE, there's no retention of staff. People are leaving. We know it's kind of a geographical lottery is what we're hearing for children around the country as to how good their service will be. And if you can't entice people into it, like, we hear about HSE mismanagement all the time. It's one of the biggest health budgets for such a small country per capita. 6% spent on mental health. I can't imagine how frustrating it is working inside there and going, I can't look up someone's file. I've got to find a page somewhere in the country. Like, what are they doing?
Yeah, I think that's what Susan Finnerty found in the report, that clinicians on the ground are working very hard, that they're burnt out and they're trying to do what they can. But even the scarce resources that's thrown at CAMHS are being mismanaged. So you're not putting it in the right way. And the fact that you don't have integrated care between mental health services, disability services, educational NEP services, community services, it means that money doesn't follow the patient, and therefore it seems on the ground that everybody's throwing this referral to somebody else for fear it would take up the scarce resources that they have. And it's not that they're keeping them from themselves, it's that they know if they have a seriously mentally ill child, they need to be able to make a difference to that child.
Can I just ask you, what's most important? If they are to try and change something, is it the computer systems? Is it to try and train up more psychiatrists? What do you think has to be done?
There has to be a look at the broad system. There has to be better management at the top. There has to be a sense of where the money is being spent.
Yes.
And is there actually good coming from it, evaluating services. There are no outcome measures in child psychiatry treatment in Ireland, and there's no data collected of even how many children we have and where they are, whether they're in beds in Crumlin or whether they're in beds elsewhere.
I can't believe that.
I can't tell you the amount of people from a medical point of view, consult that have sat there where you are going, where is the money being spent? And this is what's happening all of the time. Thank you so much. And I know that you're doing this work and you just want there to be something happening. And this is all about children at the heart of it. Professor in Child and Adolescent Psychiatry in UCD and consultant at Children's Hospital Ireland Crumlin. Thank you so much for joining us, Fiona McNicholas. Thank you. Thanks very much. Parents or guardians with queries about children currently attending CAMHS, they can contact their child's team directly or call HSE Live at 1800 700 700. And if you'd like to get in contact with us about what's going on, it's 0896 111 111.